This video will cover documentation on the day of surgery for our pre-anesthesia assessment. Much like the outpatient assessment, we'll be using the Anesthesia Medical CPV. There's a previous video going over the outpatient clinic assessment that details each of these components. I suggest you watch that video first. So it's the day of surgery and our patient is now presenting for laparoscopic cholecystectomy. We can see that all the previously entered information from our outpatient note is visible, including past medical history, previous surgeries, our previous consult note, home medications, previous outcome measures, and observations. If there is no additional history elicited on the day of surgery, we don't need to add anything to this. If we do take additional history from the patient, we can add it here, ensuring that we save the input. Examination findings do not carry over from previous notes, and we can add our assessment here. In assessment and plan, we can indicate that we have discussed a GA with him again for his lap cholecystectomy using an auto text and assign an ASA class. And then we can generate our pre-op assessment note. We can see that all the information from the CPV components has pulled through to the note, and there's an opportunity to add to it or fine-tune it. If there are any additional discussions had, they can be entered here. And if there is a plan for the pre-op nursing staff, we can document it here also. Do note that the fasting status will be pulled in from the nursing check-in. We can then sign and submit. If we want to chart a pre-med, we can come to our quick orders view up here. In this view, we have a list of pre-medications. Here we have a Ventolin neb, and if we click that, it adds it to a basket for signature. Simply sign the order and inform the nursing staff to administer before surgery. We can now see this on the MAR summary. That's our pre-anesthetic assessment done. For high turnover lists, such as endoscopy, auto text will be very useful to complete the documentation in just a few clicks. We can now bring the patient into theatre.